All right there. Hello, home healthcare heroes. This is Amy Regester with my mom, Teresa Regester, the home health mentor, with another Q&A Friday for you. And today we're talking about infection control. Before we started, my mom said, if infection control can be fun, we will be having fun today. So welcome. And as always, if you've got questions for us about this topic or another one, the best way is through Facebook Messenger. You can put comments in this under this chat too, and we'll see it and we can circle back around to it at the end. And today's going to be both some fun stories and some education. These things will help you with your survey prep as well. So please stay tuned. If you haven't met my mom, she's awesome. And she's got a lot of experience in various aspects of home health. So today she's going to be bringing you all that knowledge about infection control. Teresa Regester. Hello, good morning. And what have you got for us today?
Well, good morning, Amy,
Hi.
and listeners. I thought I would start with a couple fun stories that happened to me when I was doing surveys. Um, because, we talk about infection control and it's also, focused on policies and procedures and hand washing and we kind of forget sometimes that when surveys are going on, real life is happening in our patients' homes. And some of the funniest things that have happened that involved animals is what I thought I would focus on this morning. So just one thing that was funny is one of the nurses had a roller bag that she used going into patients' homes. And so it's low to the ground, right? So she was taking care of the patient and left her bag open. And as I was standing and trying to observe what was going on with the care, the family's cat came into the room and jumped right into her supply bag. And of course, the nurse had her gloves on, and she looked at me horrified,
Oh
like
no.
I have no idea what to do right now. And it was hard not to just burst out laughing because obviously, nobody expected that. Anyway, so I won't tell you exactly what happened after that, but I will tell you that I did have to write up a citation on that, and they did have to do a plan of correction.
Oh no. Pesky cat.
So it was the cat's fault. Actually, that led me to advise people that are clients of mine to make sure that their staff know that, number one, using roller bags have some, there's some
Some
dangers
drawbacks.
there. Yeah,
Yeah.
there's some drawbacks. And then secondly, anytime a nurse is getting stuff out of the bag, if they don't need to get right back in, it's a good idea to close it. And to make sure that the family's cat is not close by. Um,
Yeah. There's
yeah,
just some things you can't have known until they
no,
happen to you. So that was like unfortunate, but thank
yes.
you for the story, whoever you were.
And another time, I was observing care in the home of an IV patient, and so the nurse was there, making the visit, and this particular patient had a very small dog that was a favorite who often, laid next to her on the bed. And the dog had been moved to the bottom of the bed just to make room for the care that was being done. And as we glanced over at the dog, it had decided that it would chew on the IV tubing.
No.
and uh, and it only took one look from the owner, and the dog looked up and then looked down like it knew it did something wrong.
I'm sorry.
I'm sorry, I didn't mean to do this.
But
Anyway,
too late.
so
Also a
yeah.
citation.
Well, it didn't eat through the tubing. It just kind of mouthed it. But it was again one of those real life situations where you have to say, okay, when you're doing care, it's probably a good idea for someone to be paying attention to what's happening with the animals in the room. So yeah, animals are great, but they really should not be part of the care plan. So, um, words of caution.
Right.
Anytime there's an animal around, pay attention. Okay,
Uh, I
so
feel sad for the aides who have to be like, I know this is your dog's the one thing you live for, but can you please get him off the bed for now?
well, especially if there's some kind of a treatment going on or wound care or those kinds of
Yeah.
things, obviously.
Yeah.
Um, So, yeah, word to the wise. Just make sure you know what's going on with the animals in the room or in the household, and close the door, or, close your bag, whatever you need to do to make sure that you're keeping things under control.
Okay. Good
Okay.
tips.
So those were the main stories I wanted to share this morning. So, infection control has obviously always been a part of healthcare, and it's obviously also been a priority in the home health setting, partly because we are always guests in the patient's homes. There are times when we really have to just work with the situation that's going on. Um, but it was surprising to me that when I started working as a surveyor in 2013, there wasn't a condition of participation that really focused on infection control. And I remember thinking that it was odd that I could find infection control problems, but I really didn't have a a real place to put that citation.
Hmm.
So I was I was glad that in 2018 the COPs were revised to include the infection control condition of participation. And for those who would like to look it up, it can be found under CFR 48470. And what it says is that the home health agency must maintain and document an infection control program which has at its goal the prevention and control of infections and communicable diseases. So there are three parts to that. A, the standard has to do with preventing infections, and that requires agencies to follow accepted standards of practice, including the use of standard precautions to prevent the transmission of infections and communicable diseases. The second standard is to control the spread of infections, and it says that there's a couple really important points here. The agency must maintain a coordinated agency-wide program for the surveillance, identification, prevention, control, and investigation of infectious and communicable diseases. That is an integral part of the agency's quality assessment and performance improvement program.
Hmm.
And, and then it specifies under that standard what must be included in that plan. So, or in the program. So the reason I emphasized a couple words here, it has to be coordinated and it must be agency wide. And then under those two requirements, it goes into the kind of the subset of what is included in that kind of a program. So it has to include surveillance, identification, prevention, control, investigation, and then practically speaking, it normally is seated within the agency's QAPI program. And I'll go into that a little bit more.
Yeah, I don't know what that means.
Yeah, the quality assurance program.
Okay.
So then the third standard has to do with education. The agency must provide infection control education and then take note of who that education must be given to. It would include staff or employees. And I say that because I don't mean STAPH, I mean staff,
Mm-hmm.
STAFF, to staff, patients, and caregivers. So if you look at this COP, it tells you exactly what a surveyor is going to be looking for during your survey. And this year, and probably next year, and hopefully, sooner or later, we will see this current virus challenge disappear. But for this year and probably next year at least, surveyors are going to look at infection control with a slant toward how agencies have handled the COVID-19 emergency.
That makes sense.
Yeah, yeah. That said, the principles of infection control are still the same. And the categories of what needs to be done is no different than it's ever been. So I want to kind of look at each one of these requirements individually. So first, I want to talk about prevention. So does the agency, through its policies, practices, and training, communicate and follow accepted standards of practice, including the use of standard precautions to prevent the transmission of infections and communicable diseases? And so, as a surveyor, some things that I would look at is, did the agency provide their staff with appropriate personal protective equipment to protect themselves and their patients? So again, this is, you're always looking at not only what is in writing, but what is being done in practice. So surveyors might ask the staff and patients during home visits about the use and the reuse of personal protective equipment during the COVID pandemic. If you recall, there were a lot of agencies that had a really hard time getting enough personal protective equipment. And there was a time when hand sanitizer was really in short supply.
Yeah.
So, how did they handle that? What did the agencies do to make sure that they were at least being as safe as possible? So, what problems did they run into? And then how did they handle that? So the surveyor might ask the administrator or the clinical director what they did to try to locate supplies, might ask them what part of their budget did they spend on personal protective equipment. One thing that I frankly was appalled at when I was doing surveys is how many agencies were not supplying their employees with the basics like hand sanitizer
Ooh.
and masks and just basic kinds of things that you would expect every employer to provide to their staff. And in some cases, those people were contractors, mostly therapy staff. They they are contractors, so technically speaking, the agency shouldn't have to supply them with those kinds of things, but it's a responsibility of the agency to make sure that they have it and that they're using it. So this is one of those areas. I, I talked about some stories, and I'll throw in a story here about contractors. Contractors tend to be red flags for surveyors because we know that they often have not been oriented well to the home health arena and what's required as far as infection control in patients' homes. So,
Mm-hmm.
if the agency doesn't know what's going on in the home with their contractors, they really need to go out and observe what the contractors are doing. They need to make sure that they have the supplies they need, that they have, hand gel or whatever they expect them to use. If the agency has a policy on hand washing that allows for, certain kinds of cleansing, then it's up to the agency to make sure that that's being done properly. So, yeah, it's important for the agency to be on top of what's going on with PPE, not only for their own staff, but for anyone who is working with the agency's patients. So,
Yeah, it seems like just like the contractor is supposed to do it, but because the buck stops with you, the contractor doesn't get the citation you do. So have,
exactly,
have
exactly.
the, yeah, just have the foresight that, you're the parent and they're the kid and they might still need some help or guidance.
Right. Yeah, they really cannot be held responsible because they're not the ones with the provider number for Medicare,
Right.
and the contract that the surveyor has is not with the contractor, it's with the agency. So the only one that can be held accountable is the agency. So surveyors are going to be looking to see how the agency actually operationalizes, puts into effect the policies, procedures, and protocols that they have seen in writing. They're going to be validating that that's been done in practice. So the surveyor is going to look at, they're going to do trunk checks. They're going to look for clean and dirty, areas of someone's trunk or car. They're going to look at the general cleanliness, but they're also going to look at how supplies are transported, and
Mhm.
specifically too, if there's if a nurse has collected specimens, blood or body fluids of some kind for any kind of lab testing, how are those being transported and protected so they don't contaminate anything else, and so they are not contaminated? So those are all things that the surveyor is going to be watching for.
Man, I tell you, I think I say this every week, but thank you, home health heroes. Whenever I hear this stuff, I'm like, oh,
Yeah,
gross.
yeah. It's it's great though. I mean, those of us who have done it love it. So we're most of us couldn't imagine doing anything else.
God must have spent a little more time on you.
Okay. The second standard has to do with control. And so controlling, as the standard defines it, is having a plan that encompasses surveillance, identification, prevention, control, and investigation of diseases. And the COP says that the infection control plan must be coordinated and agency wide. And as I mentioned, what that means, practically speaking, is that this is a major part of every agency's quality assurance process improvement
Mm.
program,
Mm-hmm.
and that the agency has a system in place that is able to capture reports of infection, whether those infections come from an employee or a patient, or if there's some kind of community spread of some kind of
Mm-hmm.
infection that they need to be aware of. So
So
any of
can you tell
those
me
things.
how does
Uh-huh.
that work on a day to day? Like, can you give me an example of,
I
um,
sure can.
yeah.
Okay, so the agency that I work with currently, we have a person who is our designated person who tracks COVID incidents in our counties. So we actually have a spreadsheet where we have all of the counties listed, and we track the cases so that we know where our patients are located, what kind of incidents and case count and deaths and all of that are going on in those areas. That helps our staff um, stay up on what's going on. So they should always obviously be cautious. It's just that kind of added incentive for them.
Mm-hmm.
If we can say, cases are up in this particular county, so make sure you're carefully screening not only the patients but the family members in the home or anyone the patients have been in contact with. So it just kind of heightens the staff's awareness of what's going on in the community
And
itself.
when do they hear that? Do they get that weekly in their meetings? Do they get a daily text, or
It
like what does that
it's
really
put
look
out
like?
in our agency. It's put out weekly. Our tracking is put out there weekly. So, and it's in a electronic format in our update reports that go out to our staff.
And would you only do that when there was kind of like already knowledge of something going on in the area? You don't just
Yes.
screen for everything and track everything all the time.
No.
Okay.
No, it would be if there is, if there's a measles outbreak, if there's a whooping cough outbreak in our area, those kinds of things. We have someone who is, keeping track of our county health department reports so that we know what's going on in our particular, areas. So it's only if there would be a reported outbreak with some kind of notice from the health department that, hey, this kind of case is on the rise.
I just looked up recent bizarre epidemics and outbreaks just for me to know.
Yeah.
And um, instead of anything recent, they bring up the dancing plague in France um, from 1518 when hundreds of people started dancing themselves to death. So,
I,
yeah,
I
real.
was not aware of that, Amy.
Well, now I'm interested in epidemics. So, thank you, internet. Yeah, okay. So anyway, there's
Interesting.
puzzling epidemics that happen at various times in history. We happen to get a COVID one during our, trips around the sun, but um, this is something that our home health agencies are tracking, keeping an eye out for what the deal is. That's pretty cool.
Yeah, and we also are most agencies are part of some kind of an association, and we get alerts and that kind of thing from a number of
Hmm.
sources. So it helps us to just keep tabs on what's going on, and if there's some kind of update that we need to get out to the staff, we send that out electronically. And I'd say probably most agencies are doing that.
Very cool.
Um, Okay, so as part of the quality assurance program, agencies should be doing a root cause analysis anytime they see an increase or an unexpected level of infection in their, in their surveillance program. So say one of the things that is going on with an agency is they they might get their report from Medicare that says you have a higher, higher than expected number of upper respiratory tract infections, or maybe the wound healing is not where it should be. So anytime the agency has some kind of shortfall, shortcoming with their statistics, that should trigger a root cause analysis where the committee that's charged with looking at these things would just, really look closely at where can we make improvements and what caused this to begin with. So, for example, say the wound healing is not showing improvement as they would expect. They might look at the products that they're using. They might look at the training of the staff. They might look at a nutritional issue. So it's their job to kind of pick apart that problem and figure
Anything
out.
that could affect the outcome. They're just problem
Yes,
solving.
yes. Right. It's exactly what they're supposed to do. They're supposed to look at the outcomes and say, whoa, what's going on in our agency that is contributing to this? Or maybe it was just a fluke. Maybe they're getting patients out of, a particular inpatient facility, and maybe it doesn't have anything to do with that agency staff. Maybe the patient's coming out of the hospital with an infection. So those are the kinds of things that committee has to look at and figure out, and then make recommendations on what they need to do to try to improve things. So when the surveyor is looking at infection control, they will also be looking closely at the QAPI committee and how effectively that committee is identifying problems and then making recommendations for improvement. And if there is improvement, then the surveyor is going to be satisfied that that agency is doing what it's supposed to do. If they're not seeing improvement and there's no reasonable effort to make improvements, then they probably will get a citation in, related to that.
I
And
would
then,
hope so.
yes. Then lastly, talking about the education standard. So agencies are expected to provide infection control education to the staff, to patients, and caregivers. And that's done in different ways. Obviously, staff are trained at the time of hire on infection control. And then most agencies have, even in the past, done at least annual training on infection control. It is now a requirement that agencies teach their staff about infection control annually. Patients receive information in a number of ways. Sometimes it is through an admission handbook that patients are provided with. Sometimes that is only part of the education. Obviously, there's one-on-one education that happens between the staff and the patients and caregivers. Sometimes patients actually ask questions of the staff, and the staff will provide them with some kind of special printout of information about whatever the patient has questions about. So it happens in different ways, but whenever it happens, agencies are supposed to document that education has been provided, and that should be in the nurse's notes or the therapy notes, or whatever documentation is appropriate. One of the problems that I saw as a surveyor is most agencies seemed to be focused on meeting the requirement of the standard rather than the intent of the standard. And what I mean by that
Mm.
is that a lot of times they just buy something that has a heading called infection control.
Oh no.
And they have their staff read an article and do a little post test and call it good. That's not really what the intent of the standard is. I mentioned that the QA process is supposed to identify issues. So the intent of the standard is that when an agency knows what its problem areas are in relation to infection control, that they will train to that issue. So if you have, if you have a problem with wound healing, then your infection control training would ideally focus on improving, whatever kind of technique needs to be focused on. Maybe it is hand washing, but maybe it's on, your sterile technique, for example. Anyway, the point being that ideally it's not just something you pull off a shelf, pull off a binder, pull out your policy and just go over it in a half hour and then call it good. It's supposed to be meaningful training. And so every agency really should be able to answer the question, why did we choose this topic for our training on infection control? If you can't
It's so key.
if you can't answer that question, then you're probably not providing meaningful training.
I have another question about training because, we've only done a handful of Q&A Fridays, but on several of them, we've talked about that trainings need to be done annually. And I'm guessing that you're just going to keep saying that on a variety of things.
Yeah, most things have to be updated annually.
How do home health care administrators schedule all the annual trainings? Is there just like a monthly in-service where you cover everything, or staggered, or how does someone do that?
Again, it depends on the agency. There are contracted organizations who have, and I probably shouldn't mention any specific names, but there are companies that provide online training, and a lot of agencies will contract and then choose to put in your employees, queues, the training programs that they have to complete. And usually it's someone who's been designated as the educator, as the clinical educator, who makes those decisions. So, for example, the director of education or their education coordinator, whatever the title is, that person will look at the issues that need to be covered, and then most of the time they'll look at the resources that are available and choose topics and training sessions that are appropriate for, say, your nursing staff or your therapy staff or your home health aides, and they will list that in the online requirements for a person, that has that position. So, for example, my list is going to be on fraud and abuse, on I will have something on infection control. I'll have something on reporting abuse and neglect. Those are common topics. And so the education coordinator will choose those topics. In small agencies, usually the director of nursing will hold a monthly training session with
Hmm.
aides, for example.
Mm-hmm.
Um, and sometimes it can be on a webinar or a Zoom call. Those are, it can be done different ways, but usually there's one person who oversees the selection of the topics and makes sure that all of the required topics are covered in that year's time. Some agencies do a kind of a training fair where they'll, over maybe 2 or 3 days, they will have a room set up where you can go from station to station and have some kind of training and do a post test or demonstrate hand washing, whatever might be required for their particular agency. So the training can be done different ways. I mentioned before when we were talking about home health aides, you can actually do some of their training at the bedside and document it
Mm-hmm.
as, their infection control training. So again, it's done different ways. The main thing is that the agency has to be able to document and explain how they're meeting the standards.
Yeah, a lot of training. Thank you for doing it.
Yes. So I see that we we are almost uh, running out of time here. So what I wanted to say is that again, if you have questions about infection control and the requirements, you can go to CFR 4470 and review this section and look closely at G tags 682, 684, and 686 and read through on your state operations manual. Look at the interpretive guidelines, and that will help a lot if there are any questions about how these standards need to be met. I will just suffice it to say that although surveyors will look closely at agencies' policies, procedures, and protocols, they'll look at, all of your all of what you have in writing in your manuals. But what's going to really hold the most importance is
Mm-hmm.
whether or not they can validate that the agency is following what they have put in writing. And I suspect that 2021 and 2022 will be 2 years where infection control citations will be higher than they have been in the past.
Mm-hmm.
So I would just recommend that you really look over this COP carefully and make sure you kind of pull it apart, make sure you comply, do your own audit of your policies, procedures, protocols. And then I really advocate for the clinical director, clinical supervisors to go on home visits with the staff and make sure that you are comfortable that your staff know how they're supposed to be
Mm-hmm.
compliant in the home setting. Do trunk checks. That was one of the things that we did as part of our QA program, where I have been in the past. We always did trunk checks, making sure that people had their clean and dirty boxes or containers uh,
Ooh,
ready to go. That
are those surprises?
we what we did, depending on the size of the agency. So I've been in small agencies and bigger ones. We just told people just be prepared because we may tap you on the shoulder unexpectedly and do a surprise trunk check, and then what some of the agencies did is when the RN was going to do a supervisory visit on an
Mm-hmm.
LVN or an aide, they would also do a trunk check at that time. So,
That's cool. I could see it as an additional way to do an employee appreciation. You know, if you have a stellar looking trunk, um, maybe you get that Starbucks card. And if you don't have a stellar looking chart, you go back on the list to surprise again, you know, in the future.
well, and again, the goal of this is to catch people doing it right, not
Yeah.
catch them doing it wrong, and to correct any misunderstandings that someone might have. Um, it's all in the culture and how people are treated if you find that there are
Yeah.
problems.
Don't be
So
creepy, fear mongery types.
right, right. That's not what this is for. The intent again is just to make sure that if you have staff who either don't have the appropriate equipment, and again, in some agencies, they're working on a really small budget, but you can still have a cardboard box lined with a trash bag, for your dirty stuff. You don't have to have a plastic, thing that you bought for $10 or $15.
Yeah, but
You,
I
you
just
can
went to
still
Dollar
apply the
General.
principles.
I
Yeah.
went to Dollar General yesterday and there was one of those nice drink containers with a 4-inch hole in the lid. So that was $1. I could probably afford that before I got a cardboard box.
Yeah, those are the kinds of things that the surveyor is going to look at. We're not concerned so much about whether you have the best equipment or the everything is perfect. What we're looking for is the agency following the principles of good infection control, and
Hmm.
are you training your staff and then documenting your follow through.
Hmm.
So the whole purpose of this whole thing over infection control obviously is to make sure patients, staff, and um, caregivers are protected as
Right.
much as we can.
Very good. All right. I
So
don't
that's it for today, as far as I'm concerned, unless anyone had any questions.
Nope, we don't have any questions today. But I did want to say thank you. I saw a couple people pop on here in the last few minutes, and I just want to say thank you for joining us. Also, I wanted to show off a couple featured products that are in the product section at thehomehealthmentor.com. I've made you a lovely compilation here of a new shirt that we have created just for you, Home Health Heroes. Educated, dedicated, and caffeinated. Both a t-shirt and a mug. So if you are into creating company culture and you do like to give gifts, I know that for those people going on early morning runs, coffee is part of life. So that's why we made this one. And then also, if you're interested in any of the information we have, this Ace My Survey course, also available at thehomehealthmentor.com. And just want to make sure you know that part of what we do here is create resources that's going to help you, especially when it comes down to survey time. So please check those out. And thanks again for your attendance and your questions. And Mama, any idea what you want to talk about next week yet?
Yes, I was just going to tell you, I am going to talk next time about medication management.
Ooh, that sounds fun. Even more fun than infection control.
um, and I might have a story or two about that.
All right.
I'm thinking of one right now that I should be able to tell next week.
I'm here for that. I love the stories. Stories from the field. All right. Thanks,
Okay,
everybody. We'll catch you
thanks.
again next week.
Bye bye.